Hello, my name's Sarah. I'm an occupational therapy assistant with Encompass Home Health. I've been with Encompass for over 10 years and I absolutely love working in the area of home health. I feel like it is very beneficial to the patient. We are trying to keep them in their homes sometimes when they're close to having to move out or have more assistance. So my goal is to make them as safe and independent as possible. I mostly work on with everybody bathroom safety. 80% of falls happen in the bathroom. And so we always hit on this. I typically like to try to see them at least do a dry run of a shower, because a lot of our patients will say that they're showering just because they're embarrassed, and they might not have gotten in the shower even for a couple of years. I like to work on modifying their home for as cheap as I can, because a lot of our patients are on fixed incomes. If we can't modify the bathroom safely with the funds they have, we have other resources. Social work can go in and look into other community resources, whether it be transitioning the patient to a higher level of care or just maybe some outside assistance, get them the things that they might need. One thing I love about Encompass is we treat the whole patient. So I'm not just working on bathing or, being able to vacuum, but working on, maybe what got them into the hospital in the first place, their congestive heart failure. So I might generalize cooking a low sodium meal for a congestive heart failure patient into their treatment plan, so that not only is the nurse educating them on a low sodium diet, but we are actually starting to cook that way so that they can see what that might look like. Because there's a lot of times that they might say they understand, but until you actually have them prepare a meal or plan it, they've really never put a lot of thought into it. So again, treating the whole patient and looking at what their goals are, not what our goals are. Like I had a lady the other day that her goal was to get back to gardening. So I was like, what a perfect time. So we've been getting out and, working on safe ways for her to get to her garden and an emergency plan if she were to fall. Anyways, we just look at the whole situation and modify our plan, as to what the patient might need. So I just wanted to give you a little insight as to what we do in occupational therapy. I think a lot of times we think of upper extremity strengthening or, being able to get to and from the toilet. And sometimes it looks a little different than that. So I hope that this answers a few questions that you might have and that you're having a great day. Thank you.